Hi, it's Dr. BCW here to take you on a journey with me as I get a mammogram. So, as a lot of you know, last year I had my first mammogram and I decided to memorialize it in hopes of really raising awareness of the importance of getting screened and how it can really save your life. And through that journey, I ended up getting an abnormal result that required a diagnostic test. And so I had to go back for a second test, and I took you on that journey with me as well, because I really wanted to highlight what is a diagnostic test and why it's so important to get it done. The results were normal. Now it's October again, and I am here to record my second mammogram. And the reason why I did it this year was, of course, I needed to get one, and I'm going to continue to follow up, but I wanted to highlight the importance of ongoing investment into your own health and just sharing this message with as many people as I possibly could. I also wanted to just talk about how all of the memories, the feelings of anxiety that I felt last year came back, and this fear of what will this year show. And so that's another reason why I just wanted to find a way to encourage others, whether it's your first mammogram or it's time for your follow-up mammogram. It's so important to get it done. We know that the majority of people diagnosed with breast cancer had no family history, as well as it's important to recognize that Black women are disproportionately affected with breast cancer, getting the most aggressive type. And so as a Black female physician, it's important to me to find ways to advocate for everyone, but also for people of color. So go on this journey with me as I get my mammogram this year, and I'm going to take you behind the scenes, just share what it's all about. And my only ask is please share this with others, because this could save someone's life just by sharing what is a mammogram, why it's important, and their risk factors. Thank you. I just checked in for my mammogram. I can tell you it was easy. I had to just fill out a couple of pieces of paper. I'm ready for my mammogram. So. I just came back and I was asked, do I have deodorant on? I forgot last year that it's better not to have it, but don't let that deter you. If you have your mammogram in the middle of the day, at the end of work, you have the option to go ahead and remove it. Don't think that you have to do this full level of preparation. They will have everything for you. I've got my robe, I've got my little wipe to get my deodorant off. So I'm also really grateful to have the same specialist with me as I did last year on this journey. So that warms my heart. And well, it just made me so happy to see you. I'm happy to see you. Yes, and I had shared with her, and she knows what happened last year when I decided to get my first mammogram, and then I got the abnormal result, and I had to come back, and I was so scared to come back, and you helped me. And the reason why we're doing it this year is to help those to understand that you have to don't let those fears stop you from continuing on and getting it done. I appreciate you, and thank you for just being.
We'll let you be dressed.
Okay. Thank you. All right, I have changed. I used the little wipes, have my gown on. As women, we tend to feel like we have to have all of these things prepped in advance before we do anything. So I don't know if this helps someone else, but I didn't shave my arms. I didn't do any of that stuff. It doesn't matter. All that matters is that I'm here and that I'm getting my mammogram. The majority of breast cancers are with people who have no family history of breast cancer in their family. And so if you're thinking, I don't have any history of it, I am fine, I really want you to kind of just consider that is not an element that can reduce your risk of getting breast cancer. The other thing that I want to share is for Black women, we are getting diagnosed at an earlier age, dying at an earlier age than the recommended screening. And so that's another factor for you to consider.
I just would like the ladies out there to know, while Dr. Curry is here, that ultrasound is not a substitute for a mammogram. A mammogram is the gold standard, and you want to have that because there are things that we can see on a mammogram that we can't see on ultrasound.
All right, so we are in the room. This is the mammogram machine. It is an x-ray. Often people want to know what is involved in a mammogram. And so it's just taking a picture of your breast in hopes of, finding any possible abnormality. If they do find something, that is the first step. And whether it's a normal or abnormal finding, you now know. When it comes to breast health or any sort of cancer, there's no way to know if you're gonna have any signs or symptoms. And some of the common symptoms are nipple discharge, a discoloration to the breast, dimpling. However, a lot of the cases, some women had no symptoms. And so the first time they found out that they had breast cancer was through the mammogram.
Hey, before we get started, I just want to ask you, have there been any changes in family history?
There have not.
In your health?
No.
And that's it. If there haven't been any changes, then we're good to get started.
Reflecting on how it feels, because often so many of us are like, oh, it's gonna hurt or pinch. Last year, it felt like a very tight hug. And this year I can say the same thing. And they say it's gonna be kind of like a pressure and an awkward feeling. And so it just made me kind of think of some hugs can be awkward and feel pressured. Again, it feels like a tight hug, a squeeze, but definitely doable. You are always asked, how are you doing? Is that too tight? And I think that's an important piece. They will do the best that they can to make sure you are comfortable as possible. I know there's so much concern and fear of, is it going to hurt? But just know when you go in, they will do their very best to make sure you are comfortable as much as possible. So I just finished my mammogram. I can tell you it was very easy. From the beginning to the end, just like last year, instructions that provide context to what to expect, and level of attention that was brought forward with how to adjust my breast and what was going to happen as the machines moved and the noise, that's associated with it. I had all of the information ahead of time. I felt very comfortable. Overall, it just nice to know that, again, I have taken the time to do something for my health, make sure I stay healthy for myself and my families. I hope this inspires, encourages you to share this important screening that can truly make a difference in your life. And it doesn't have to be breast cancer month to go and get your mammogram. Think about it every month. If you're due, on a specific month, mark it on your calendar, put it in your phone, make it a priority, because when you do that, you are making your health a priority.